So COPD, chronic bronchitis, and asthma, they all fall into the chronic inflammation of the lungs. Because the stem cells are very good at regulating immune system and reducing inflammation. And also when you have intravenous injection of the stem cells through the vein, the first place it goes to is the lungs. So that's why it's very effective in treating COPD, chronic bronchitis, and asthma. A lot of times the conventional treatment would be steroid, and I don't think there's any other effective treatment for it. So people would still have the symptoms. They do not get a lot of relief out of that, or just temporary relief, and it doesn't really relieve the underlying cause of the conditions. So they would still have the chronic inflammation in the lungs, and over time it would still develop into very bad obstruction of breathing, and eventually the lungs can just stop working. So eventually people have to rely on oxygen because their lungs cannot function to even 50% of the capacity. Stem cell treatment can reduce the chronic inflammation in the lungs and restore the function capacity for the lungs. So I've treated an 86-year-old lady who has had chronic bronchitis and COPD, since she was in her 40s. So we not only use the intravenous injection of the stem cells, but also she used the stem cells in her nebulizer, so she could get the stem cells into her lung directly. After that, she can reduce her medications for her chronic bronchitis, and she hasn't had as many asthmatic attacks for her condition. And she only had this treatment once. So for somebody who has been suffering from chronic bronchitis, asthmatic attack, that conventional medicine has now been helping you, considering stem cell therapy would be a very good alternative for creating long-lasting effect.